study today is a 25-year-old female who has spastic diplegic CP and just had, she has a tight gastroc on her right leg, which means that she has to walk on her tippy toes. So about a month ago she had an acute, she had a tendon lengthening surgery, and they put her in a cast following, and after that she, about a couple days ago, she just had her cast taken off. So I'm choosing to treat her using ultrasound because ultrasound has been proven to accelerate healing for after tendon lengthening surgeries and also for surgical incisions. And I'm choosing pulse ultrasound because that has proven to be more effective over continuous. The contraindications for this include pregnancy, malignancy in the past 5 years, CNS tissue disorders, if she had a joint replaced and they use plastic or cement components. Also, obviously we don't want to do it over her eyes or her reproductive organs, and we want to make sure that she doesn't have any blood clots in the area. The precautions would be implants in her breast, fractures, epiphyseal plates, and acute inflammation if it was doing continuous. And so now we're just going to go step by step for the use of ultrasound. The first thing is to set the goal. And the goal of this treatment is that we will accelerate the healing of her tendon and the surgical incision. And now to determine if it's most appropriate, we have chirotherapy, thermotherapy, or ultrasound. And ultrasound out of all has been shown to improve the incision, so that's why we're choosing it. Now we have to screen Megan here to see if she has any of the contraindications. So, are you pregnant, or any chance that you could become pregnant?
No.
Have you had cancer in the past 5 years?
No.
Do you have a history of blood clots in your right leg?
No.
Did you have your ankle joint replaced?
No.
No cement or plastic?
No.
Okay. And so those are all the contraindications. Pacemaker is a contraindication, but we're far enough away that we should be able to use the ultrasound without there being a problem. And so now that we have seen that she is okay for this, we're going to position her. And to get the best use with the ultrasound, you're going to be prone. You can just lie down on that pillow for me. And then we're going to support her ankles. So we're going to roll the towel and there we go. Pull that up. And then we're just going, this is just for comfort for this leg, that way it's up. There we go. Alright. And now we're going to apply the transition medium. And we just want to make sure that she's not allergic to the gel. But other than that, we're good. So we're just going to apply it right on her Achilles tendon. You want to make sure you get a lot of it there. And then just when choosing the size of the head, you want to use the size that's going to be half. So because we're using the Achilles, the tendon, it's a small area, we're going to use the 2 centimeter side. And then we need to set the ultrasound machine up. So for my frequency, I'm going to use 3 megahertz because the Achilles is fairly superficial, 1 to 2 centimeters deep. And the intensity is going to be 0.5 watts per centimeter squared. We're using a high frequency, so we're going to use a low intensity. The duty cycle is 20% because we're going for non-thermal effects to heal the tendon and the surgical incision. And then the duration is between 5 to 10 minutes, so we're just going to go with 7. Before we put the head on her, we want to make sure that we clean it. So we're just going to give a nice little cleaning there. And then we're going to put the head on her Achilles tendon before we turn the ultrasound on. And we're going to do, you can do little circles or a little S shape, but you just want to make sure you maintain contact. And you do this before you turn the machine on. Highly important. So we just move, and we would just do this for 7 minutes or so. And then when we're done with treatment, we're going to turn the machine off and then take the head off. And so then after we take the head off, we're going to wipe that down, put it back, then wipe off her ankle, reassess, we're looking at it. Our expected outcomes are that the tendon will heal quicker and that the surgical incision will be less red, so we just reassess the skin, make sure it's good, and then we document. And that's how you would do post ultrasound.